Hello, this is Dr. Lorenz here, Longevity Health Institute. Good day, hope you're well. And I'm here to further educate you and maybe entertain you. So I hope you're doing well. I haven't done one of these in a while, but one of my New England Journal of Medicine reviews and kind of my take on some of the studies that are recent and that are being published here. So let's dig into this because there's some interesting things that might open your mind about thoughts about things. And here's one that's huge that I'm going to share a case with you, but this is huge because we see this here is that patients, especially with aging, that they are put on medications and there's never any secondary thought process to removing those medications or reevaluating if there's a need or if there's conflict with other medicines. And then you add 2 or 3 or 4 doctors on board and no one's communicating or quarterbacking, and then what happens is that polypharmacy happens, and I'm going to tell you right now, it's not good for you or your system, and then who knows what can happen, right? So this is actually a study. Again, this is actually a New England Journal of Medicine review, and this just actually came out in March. This actually study was published in Critical Care Medicine 2024, February, and the article is about proton pump inhibitors, how they're initiated in the ICU. So these are used in the ICU setting for any reason. They're initiated, and 11,000 patients in this study, were evaluated, that they were left on the proton pump inhibitor 8 weeks after discharge, regardless of why they were in the ICU, put on the medicine, or had any digestive issues. Now, to back up, proton pump inhibitors are a medication that blocks acid production. And often they'll do that in the ICU to protect the gut, if you will. Meaning, you have less chance of developing an ulcer in a stress response situation if you're on a ventilator or if you're in sepsis and you're getting antibiotics and all these things. So they'll put you on some medicines to protect your gut, which is actually smart in that kind of setting, and that critical care kind of setting makes complete sense. But no one's reevaluating this, and then literally over 40% of their patients without an indication were still 8 weeks after being discharged from the ICU still left on these PPIs. And so this is concerning because, again, this person doesn't know. Perhaps they're older, perhaps there's nobody looking at this, and they're kept on it. And then what does a PPI do? Well, that by blocking acid in the future, it's well documented, there is higher rates of magnesium absorption issues. So they're hypomagnesium. They have a higher risk of arrhythmias. So malabsorption in general is huge. And actually that can even lead to less calcium absorption, so higher rates of osteoporosis, And in general, your gut is the window of how you get all your nutrients, whether you're eating or taking supplements or even your medication absorption, So PPIs are not just some, because they're over the counter, they're not just some, bubblegum thing here or, some placebo. They really need to be taken serious. And again, 11,000 people, more than 40% of them were left on for no reason, So that's my take on that. Not good, all right? The other thing here is, and I'm going to totally dispute this, but there's an article here that was published in JAMA in 2024, February, that bariatric surgery is superior to medical management for long-term diabetes control, meaning bariatric surgery is better than some of the medicines. And I'm going to dispute that. And why I'm going to dispute that and really have to say something about this is because I see such wonderful things with GLP-1s, like tirzepatide and semaglutide, like the over-the-counter, the prescriptions, like Wegovy and Ozempic and that. But we use the natural compounded versions that we can microdose of semaglutide and tirzepatide. And I don't know. I see amazing stuff with diabetics. I see amazing weight loss. I see lipid reductions, and we watch people very carefully so that they don't get muscle loss. And I've seen just amazing, wonderful things. One of the biggest risks to patients is inflammation, and we'll see their inflammation drastically drop. So, I dispute this kind of, I think that you got to look at every study individually, and I kind of wonder who supported that study. The other thing that I thought was just interesting in this was an article here that was published in Clinical Journal of Endocrinology and Metabolism in 2024 of March, and that how there is an incidence in older adults that have mildly hypothyroid, so mildly elevated TSH, okay, that they just spontaneously normalize in about 50% of the cases within 1-2 years. Well, there's a reason they normalize. They don't just normalize, okay? Is very likely that is a digestive and gut thing and a nutrient thing. So just remember, you always need iron, minerals, iodine, okay, and a good gut metabolism and biome, bacteria, to help your thyroid work, okay? So my guess in this is they're getting healthier, and they're being tracked and talked about their diet, and some more than half of them, okay, normalize their thyroid function just because their gut gets better, okay? That is interesting. Now, this one I love because it's so underappreciated, and it's proven here and backed here. This is a study. The article does exercise improve symptoms of depression, and it was a meta-analysis of exercise-based interventions with at least moderate intensity. Higher intensity was even more beneficial, but with at least moderate intensity, and if they had beneficial effects. So what do you think? What do you think I'm going to say? Well, of course it had beneficial effects. And here's the thing is, yes, there's some commentary on this. This was actually published in the British Medical Journal in February of 2024. It's interesting because there is some commentary on here about, really how accurate this study was, and it needed to be further reviewed, and when they compared to SSRIs and all that. But when they compared to controls, okay, and again, more intense exercise was even more beneficial. But 14,000 participants in this, okay, that were compared, and there was over a 50% report of improvements in their mood, okay? I'm gonna tell you that dopamine rises with exercise. And the reason more vigorous is because you gotta get vascular blood flow from your gut and your brain to make dopamine, to make serotonin, okay, and to open the brain and open everything, okay? And I will tell you that no question we can improve, okay? It's not the cure to depression, but it is no coincidence that sit in front of the TVs and social media and phones and computers and work desks all day long feed our bad neurosis of our brain. So I think this is very actually interesting and very accurate. And this one I see still all the time, and I'm going to wrap it up and get to an interesting case, like I said. But this was published in New England Journal of Medicine 2024, February 29th. It's titled Mild to Moderate Cognitive Deficits Persist After COVID-19. So yes, people are really sick of, talking about and hearing about, and some people actually go, oh, COVID's over and this and that, and it's not as serious. Well, that's somewhat accurate. Less people are dying, of course, but it's still real. It's around. Okay, we don't make a big deal, although it does make a difference, though, in what infection you have for us to treat from a physiologic functional level. But I will tell you what's interesting about this is that mild to moderate cognitive deficits persist, and we see this here. And that's beyond a year even, okay? And yes, it's a small fraction, okay, of patients, but it is real, and we see it here. And it's basically because of neuroinflammation. And this article is about how SARS-CoV-2 produces this microvascular damage and changes. And if you follow me here on YouTube, as you should, and share with others, and subscribe to my channel and on Instagram and my podcast, The Deep Six, you hear me talk about this all the time, about this microvascular, this inflammatory hypercoagulable state that happens in the brain with COVID. Okay, I even had some when I had COVID, and you can go back year and a half, I think 2 years ago when I had COVID, and I did a video after it. Is it creates a neuroinflammation, so this is why we get brain fog. Okay, but we see this all the time still. I have a lovely, lovely, lovely story for you though, and a great ending. Now you need to appreciate it first. And you need to do things that break down the spike protein and measure these things in blood so that you can make sure that you're doing enough. But anticoagulants, anti-inflammatories, like nattokinase and NAC or lumbokinase, and even baby aspirin if needed, if you have a high D-dimer in that. But you want to go on an anti-inflammatory diet. But here's the great part of the story is we use something called molecular hydrogen. It's an oxygenated hydrogen gas that actually diffuses in your body, okay, per liter more than anything. They sit for 30 minutes to an hour, a few days a week. The more the better, but they inhale this hydrogen gas. And molecular hydrogen, you can look it up, and it's world study, multitude on PubMed, over 200 studies, okay, of molecular hydrogen and its benefits. But we'll take neuroinflammation down like that. People's brains open up, their cognition gets better, and as long as we address the hypercoagulable state, okay, this goes away. So great article here in the New England Journal of Medicine. But really, it's happening now. Granted, it's not happening and everybody gets COVID, but we still see it come in here, or they'll say, "Hey, I had COVID 6 months or a year ago." And fortunately, we have some lab markers that we can watch this, but you gotta treat it, because I'm gonna tell you, anything that makes your brain more inflamed and more coagulable, meaning thick blood's not flowing in your brain, okay, you're not going to be at an advantage for brain aging. I promise you, that's accurate. So now let me tell you about a case, and I have a picture here because it really hit home. I took a picture and put it here so I could show you on my iPad or something, but this nasty kind of infection, okay, or this nasty kind of look on the skin. Now I'll go back to that, but I had a patient bring her mother to me, and the reason is because she had a lot of medical problems. She was overweight, she was diabetic, she had some immune things in the past, and she had pneumonia chronically, and not a great eater, and some kidney things, and she just wanted my opinion, okay? So I saw her, and about a month prior, she started developing these cutaneous lesions. Let me get back to, sorry. I just got off it here. She actually had these lesions here that were mostly on her legs, and that were mostly on her legs. They hopefully you can see that they look like that. They were tender on her thighs, a little bit on her belly, and flat, red, papular, and really ugly, to be honest with you, not being rude, but and they were a little tender, and she had some chronic digestive trouble for years and years and years, and never dealt with it, and now it was getting worse, and now her joints were hurting, etc. And the short of this she was developing, and I was kind of surprised to catch this because it's something I've really never seen in my practice, but she had actually true, what we used to call Hochstein purpura. And that's a fancy name, doctors like to make these fancy names, but it actually is an immunoglobulin vasculitis. So it's an inflammatory vasculitis, almost like an immune response, okay? And it can be very serious to the kidneys, and it it correlates even to sometimes an underlying cancer, okay? Now we are gonna able to help her, but where are we getting to the root to fix her? Is I finally, because of this, convinced her to dive deep into her gut health. We're gonna get a stool test. We're gonna recreate her microbiome, okay? And we did some things, I'll call it early patchwork, to get her better sooner than later, but we're gonna have to do months, maybe even years of gut health so that we can restore gut health. But I think she's finally on board because of how things, kind of have progressed. But if you don't get that vasculitis taken care of, it's gonna lead to kidney issues and potentially even lead to an underlying carcinogen. So Hochstein purpura, first one I've ever seen. Very, very interesting stuff you read about in textbooks. So this is Dr. Lawrence. Hopefully this is educational and entertaining. I'm all about bringing you information and sharing it with others. Please follow me and share this with others, loved ones, friends, family, and that. Follow me on Instagram, follow us on Facebook, as well as YouTube. And I do have a podcast now out called The Deep Six, which is about our life journey in health and in just thriving and making a generational impact on you and yours. So this is Dr. Lorenz here at Longevity Health Institute. Me and my practitioners are always here with open arms to make you thrive. Be well.